We have Secretary Jilma Meneses. She's actually the Secretary, Washington State Department of Social and Health Services. She'll be talking today about addressing food insecurity solutions. Welcome, Secretary. Glad to have you.
Good morning, I guess. Yes, thank you for having me today. Wow, what an honor to be here with all of you, and a true pleasure and definitely a privilege, right? I just wanted to share a little bit about me as a fellow Latina. I am of Nicaraguan descent. Came here as an immigrant as a child, like many of you maybe who are immigrants. Grew up in the Bay Area, but went to law school in Oregon, and have done a lot of various things in my career in executive roles. I was asked, why did you come to DSHS, or the state of Washington? Well, first of all, I've been living in the state for quite some time. But regardless of where I've been working, I've been living in Southern Washington for the past 30 years almost. But my goal, folks, is, like many of you, is to break the cycles of poverty, right? To advocate for justice and to strengthen the health and vitality of communities throughout by providing access to critical services, healthcare, human services, and many other opportunities, including education, which is a key to breaking poverty and advancement, as we all know in this space. It's one of the reasons I came here. And among the things that we do with that is as I think most of you are familiar with DSHS, but I'll just give you a high level. We serve approximately almost 3 million people, and about 20% of those 3 million people are Latinos, Latinx community members. That's a big population, especially because there's only about 1 million of Washingtonians are Latinx or Hispanic or identify as such. Yet at DSHS we serve about 21%. That's a big number. Anyway, as I was saying, we do a lot. We serve a lot of folks. We have over 17,000 employees. We provide services around behavioral health, developmental disabilities, vocational rehab, aging and long-term care, Medicaid pathways based on age and disability, and of course, public benefits such as food security and cash assistance, otherwise known as SNAP and TANF, funded by USAID. And that's a big component for our population in Washington, and definitely for the 21% Latinos or Latinx. Some of you know Tony Bowie, maybe. He is the Assistant Secretary for the Economic Services Administration, who is in charge of just the public benefits, but we have the other assistant secretaries as well. I want to show you, if you don't mind, what I call the DSHS house. And my colleague Brenda is going to pull it up for us in a second. All right. So when I came to DSHS, it's a little over a year ago now, I found that a lot of the agencies in the state of Washington are quite siloed. And even within DSHS, as big as it is, there were a lot of silos. One of the goals that we have is to bring us together as one house, and I call it the House of Human Services. And obviously, some of the basic foundation of this house, like the basic foundation of the house you live in, has to be strong, right? That cement has to be really grounded. Well, at DSHS, one of our basic foundations is to modernize our IT infrastructure. Many of you know that the state has been a little bit slower than not in modernizing all of our IT infrastructure. So that's a big component of our key priority here at DSHS, is to do that. But once you do that, the other main basic foundation is to have staffing stabilization. And folks, that can't happen if we are not a proactive equity and anti-racist agency. I mention that again because I know that this audience understands the impacts of racial equity and anti-racism. I think if you're a Latinx member of the community, you have experienced racism. You have experienced othering, right, rather than belonging. And so at DSHS, it's one of my key priorities of that foundation is to bring responsibility and accountability to every member of the House, regardless of which administration we're talking about, whether it's economic services, voc rehab, DDA, BHA, or aging long-term care, right? Regardless of what part of the House people work for, that anti-racism has to be a foundation. So we built a House, a Office of Justice and Civil Rights to help launch along as a partner with the Office of Equity and to make sure that that accountability is goes beyond just talk, but rather action. It's really important for me as a Latina, as a woman, and as a mother, right? To end as a leader of this organization, and also hopefully as a leader in the state of Washington. We can't do the work that we do regarding homelessness or housing or behavioral health or anything else. We can't do that poverty reduction unless we have that basic foundation of staff and stabilization through an organization of anti-racism and so forth. And you can't get to the basics of cash assistance or nutrition, for example, food security, those services without that. Anyway, so that's a little bit about me. And this was just an opportunity to say hello to you, to let you know that I'm available as a colleague, as a fellow Latina, and as a friend. I'm here for you, and I'd love to hear from any of you, any questions, a word of inspiration maybe by some of you. I would love to hear, if you don't mind. I know there's a lot of you here, but I welcome anybody who would like to say anything.
Well, thank you, Secretary. For the purpose of this virtual and all the behind the scenes work, we don't have the ability to have participants ask questions, but I did want to ask you a few. First of all, thank you for really caring about this. As the numbers that you mentioned, 21%, that's really high. That was really data that that we were not aware of. And on this virtual event, there's a lot of incredible leaders that we will come together and support you any way we can as you're working through these changes. With that data though, what do you think what is your timeline of, first of all, the IT enhancement? I know that takes time.
So IT enhancements are ongoing, right? And just because you enhance today doesn't mean that you don't enhance tomorrow. Digital modernization has to be constant all the time. But the major digital modernization that we're trying to do is a big lift. For example, we're trying to have one platform called an integrated eligibility system platform, where anybody wanting to apply for services, instead of going through 3 different agencies, such as Healthcare Authority and DCYF or DSHS for various services, they go to one platform, they input their information there, and then behind the scenes, the system will hopefully track all the kinds of services that this person might need or want. Anyway, that system is going to take a few years, but we're in the very much in the development with our sister agencies. That could take up to 3 years, maybe even more. At the same time, there are what I call tugboats happening as we speak, modernizations that impact us immediately, from uploading some of our documents, meaning the client uploading their documents, to using their phones. I understand from some of our clients that the systems have been so antiquated that they've had to go through phone systems and work and wait very long times on the phone. Well, and we're not the only state that has these antiquated problems, but regardless, we have to do, for the state of Washington anyway, we have to do what we can. So there are band-aids that are happening right now with those particular telephony systems and so forth. It's an ongoing, that's a really good question.
The last question would be, our biggest concern, and I know you know this, is working families needing food stamp assistance, right, TANF, and because they don't have a job, but then they get a job, and then right as soon as their income is reported, they lose those benefits. I mean, on average, a family that of four or two, it doesn't matter size, it takes time to build your, equity over time when you get a job. This is extremely concerning. Any thoughts? I know there's been a movement, but how we can change that, allocating more time for a family, to get back on their feet. That first paycheck, goes to grocery bills. That's the reality. And so any thoughts about that and how you
Ab-
will,
Absolutely. So first of all, those income eligibility criteria are federal standards, they're not state. However, to your specific point, there actually is a bill right now to allow a family continue getting the income through state monies for another few months, I believe up to 6 months. And even though that, for example, even though they're no longer qualified in January because they got that job, the goal is to keep on giving them the income for a few more months so that they stabilize. Otherwise, that routine poverty cycle continues, right? As you pointed out, Nina. So that's a big one for us. We're working right now. Our Economic Services Administration is working very diligently on that
okay,
with the legislature.
okay, great. I guess the last question would be, under DSHS, does child support fall under that as well?
Yeah.
And my understanding is, so you mentioned, I'd like to see that slide one more time, but just to get a quick overview, but it's okay.
Your
I
house?
think,
You want to see our house?
yeah, the house, yes, if we could see the house. One more time. So if all our stakeholders on this call can see that look how important, this agency is and services, aging and long-term support, behavioral health administration. I did not know you managed Division of Vocational Rehabilitation. So that's really important. I'm really pleased to hear about the proactive equity and anti-racist, the efforts that you're doing, but definitely I didn't realize how many programs you have. So this was really great that you joined us today, Secretary.
You're welcome. Yes, we are this largest agency. It used to be bigger. DCYF used to be part of this healthcare authority, but I understand it about 3 to 5 years ago, those were made separate entities, but it still is very, very large, very comprehensive. We're doing a lot. And quite often people only hear the negativity. They don't hear about all the really good work that we're doing, impacting, like I said, almost 3 million people, specifically with food and cash assistance, which is food security, right, is critical to our existence.
Right. Well, thank you, Secretary, for your time today. Wonderful to have you join us, and we will stay in touch.